This past year, I was pregnant and gave birth to my first child. During pregnancy, specifically towards the end of my second trimester, beginning of my third trimester, I started experiencing what I now know are really common symptoms or sensations during pregnancy. Specifically for me, I was experiencing a lot of pain in my hips, and I was experiencing some pain during sexual intercourse or sexual touch. And so because pelvic floor therapy has been, for me as a sex therapist, a really common referral I've given, I decided I was going to go see a pelvic floor therapist because I had never had my own appointment. And my experience was overwhelmingly positive.
Pre and postpartum, there's a lot of trauma that happens to that pelvic floor, scarring, tearing.
During the course of pregnancy, especially as you're getting heavier and everything internally is moving and adjusting, that this can, in some people, create a lot of pressure and tension that comes out as pain during contact. So even just that was really helpful for me to have that explained. So I knew what was going on, I knew why. But then additionally, in following follow-up appointments, I was given and shown different exercises that I could do and that I could have my partner help me with, specifically related to massage, both external and internal massage, to help kind of keep the tissue loose and help decrease the pain. And it really helped. Another thing that I learned in my pelvic floor therapy during that time leading up to giving birth was the proper way to push. So during my assessment, and when the therapist was helping me do these exercises, she assessed for the strength of my pelvic floor muscles. She assessed for areas where there was tension, and she actually guided me through different ways to bring my awareness down to my pelvic floor muscles. And she helped instruct me how to hold tension and then how to relax, just like I would need to during a contraction and ultimately during the pushing stage of delivery. I realized very quickly, what I thought would have been proper pushing would not have been. I would have had a much harder time during my delivery if she hadn't taught me this kind of proper way to push. After giving birth, I then went in for a follow-up. Again, she was able to assess where my strength was in my pelvic floor muscles. I had a little bit of tearing during delivery, so she was able to explain to me exactly where that tearing was and what the scar tissue was doing. And again, exercises and ways to help break down some of that scar tissue. So not only that I wouldn't have any pain, but that I would heal more effectively. And I'm so grateful for that.